All right, guys, we're going to pick back up with VQ match and mismatch, and we're just going to go over this real quickly just to kind of tie it all together, and then we'll move into how we should be caring for our patients based upon their ventilatory effort and when we should kind of consider pulling the trigger, putting them on a vent, that type of thing. Okay, so earlier we talked about heart rate times stroke volume equals cardiac output, and that's the Q part of perfusion, and we always want that to match the V part, okay, which is ventilation. So we're always looking for a VQ match. You guys have heard that term a million times, and the V part of this, okay, is what we call ventilation or minute ventilation, and that's respiratory rate, okay, times the tidal volume gives us the minute ventilation. I've seen it written as an E, I've seen it written as an MV, I've seen it written as a V, a bunch of different ways. Anyways, what we're most concerned with is that these match, okay? So let's do an example here, okay? Earlier we had talked about cardiac arrest where the heart rate is 0, stroke volume is 0, that means the cardiac output is 0. So I come along and I start doing compressions at a rate of 100 compressions per minute. Okay, and what I end up moving there, okay, ends up being 1.0, 1 liter per minute. And the issue there is the stroke volume, okay? So in cardiac arrest, I'm only going to be moving 1 liter per minute, which is about 20. Sometimes they say you can get 25, really good CPR, you might be able to get 30% of normal blood flow, okay? Well, the good news is there, right, is that you typically stop breathing, which means that your tidal volume is 0, which means that your minute ventilation or volume is 0. So what we've got is pretty much a VQ match. So the way that it came along that now EMS especially and even in some hospitals now, the way that it came along that we don't ventilate patients during the first 8 minutes of CPR is because they have such a profound mismatch. It really doesn't matter. So if I were to look at squeezing my adult BVM, that's going to give me roughly 500 on the tidal volume. And in order to get a match here, all I'd have to do is squeeze that bag somewhere between 2 and 3 times a minute. 2 to 3 times a minute to get 1 to 1.5 liters per minute to get a match. So really when we look at BVM is not a simple skill. And we probably should be more focused on what? Saving the brain. That's our #1 goal with every single patient that we encounter is the #1 goal is save the brain. The #2 goal is save the heart, get the ROSC if they're in cardiac arrest. And the #3 goal is pretty much everything else, okay? And that's the way that we should approach all of our patients. So what's going to save the brain? Is it BVMing the patient or is it doing compressions to get that oxygenated blood to the brain? It's going to be doing the compression. So compressions are always going to come before ventilations. So that's how we've gotten there, especially when we're talking about adult patients. Pediatric patients, a whole different ballgame, okay? So anyways, let's go over this real quick, and we're just going to go over a couple of different VQ mismatches that you may see. And I just really want to reinforce this ventilation concept before we move any further, okay? So if I were to have a patient that comes in with, let's say their heart rate was 100, their stroke volume is 70, that gives them roughly 7 liters per minute, okay? And we say that the average is 12 times 500, gives me 6 liters per minute, okay? That's the average minute volume or minute ventilation, okay? Do I have a match here? And the answer is no, I've got a mismatch, okay? So this would be typically the person that's on the treadmill and running at the gym. They get their heart rate up to 100, they move 7 liters per minute. They're at a deficit on the ventilation side, so they have a VQ mismatch. Where's the problem? It's on the ventilation side. So what do you guys do when you're on a treadmill and you get your heart rate up to 100? Well, you have to breathe a little bit faster. Some of us breathe at 16, some of us breathe at 20, but either way, we breathe faster. Let's just say that we're breathing at 20. Well, it's harder to take in that full 500 every single time you breathe if you're going from 12 to 20. So when we look at that, typically what happens is our tidal volume drops down a little bit. Let's just say that it drops even to 400, right? That would give us 2 times 4 is 8 liters per minute, okay? So are we getting closer here? Yes, we are. The issue is this, is that I am building up lactate anytime that there is a VQ mismatch. I have acidosis. And when I develop enough of a profound metabolic acidosis, I have to stop because I can no longer run on the treadmill. My legs start to tire, okay? That's a very, very important concept to understand. Let's get into one other one here, okay, real quickly. Let's apply this to our medical patients. You have somebody who comes in with pinpoint pupils and their respiratory rate is 6. Tidal volume is, well, they're not really breathing all that deep when they're breathing. So we're going to say that their tidal volume is around 400. Okay? So their minute ventilation is 6 times 4. What is 6 times 4? 24. 2.4 liters per minute. So what does your body do to compensate? Well, your heart rate goes up. And we see that right here. So who is this patient? This is the opioid overdose patient. And they have a VQ mismatch. Okay? And the VQ mismatch is where? Again, it's on the ventilation side. So if I were to ask you the treatment of this patient that's an overdose, a lot of people would say, give them Narcan. Well, no, not really. That is not the treatment. What the treatment is that you always want to match your Q and your V first. Okay? You want that VQ match. Okay? And if we can do that without Narcan, well, we can create a whole lot less headache for ourselves. So if I start bagging this patient and I start giving them 500, half a squeeze of that adult BVM, okay, and I bag them at, let's just say the first couple of minutes I bag them at 16 and then I drop it down to 12, well, I'm back to 12 and 500. That's 6 liters per minute. What do you think happens to the heart rate in response to this ventilation? The heart rate's going to come back down. Now I get a heart rate of 70 times 70 equals 5 liters per minute. Am I matching again? Yes, I am. Okay? It's that simple, guys. That's what we talk about when we talk about VQ matching. You can have dead space ventilation, where you're getting ventilation on this end, but not getting perfusion on this end, where there's giant clots. Or you can have an interpulmonary shunt, where you're getting the perfusion, but you're not getting the ventilation. That's all there is to this. It is super, super simple. Thanks for your time. We'll pick up again later.